Hi, my name's Steph from Surgery App. This is a training video for practice staff. Your app now has an app. Your practice now has an app for patients called Surgery App, and it's available now for patients. So this is a short training video for you guys just have an understanding of what the app does, its features, and how it can help you in practice. I was a practice manager myself for 17 years, so I know how busy you guys are as administrators and receptionists in practice. The app is meant to make it a bit easier for patients to access your services in different ways. So we'll share screen now to show you what the app can do. Okay, let's go. Okay, so this is a web view of Surgery App. The app can be downloaded by patients in English or in Welsh. Once they download the app, they're asked to register, and they're asked to find their surgery. So whichever surgery they register with, they can either search for it, it'll bring up a geolocator. They can either look for the surgery as a geolocator, or they can type in their surgery name. So I'll type in our test surgery, which doesn't really exist, Grange Road surgery, confirm that, and then they choose their language, English or Welsh. And once they've done this, then they come to the app's home screen. And this is what they first see. So they'll see your surgery name, and your surgery obviously is part of a GP cluster. There's also a cluster page there for patients to find out what a cluster is, and there's a short animation video there to tell patients what a cluster does as well. But for the purpose of this training session, we're going to concentrate on the app's home page. So the app has been built on the scrolling basis, same as social media, Facebook, Twitter, Instagram, so patients are used to using that. You can see here we've got 4 icons on the bottom: Home, Health Hub, Your Surgery, and What's On. So we'll go through the home page to begin with. So the first pages here are just some information pages that your practice manager or your surgery may choose to tell patients about. For example, Welsh Blood Service, how patients can give blood, hay fever advice and treatment. Patients can click on this and find out more information. There's lots of educational videos there for patients. So your practice manager or your practice will upload these information, or we will do it for them. Then there's lots of buttons here for patients to click on. Now, admin queries. A lot of patients, or about 40% of calls coming through to you guys, are non-clinical. So they phone up and ask for maybe continuation papers or new sick notes, doctor's letters, change of address, or stuff like this. So when patients, it's to save patients having to phone you and clog up the phones. So we know how busy you guys are on the phones. You're constantly answering phone calls. So we now encourage patients to submit electronic forms for any non-clinical queries. So they can click on this button here, I have an admin query, and it tells them here, contact us about a fit note, sick note, on a medication query. They can click on this and it brings them to a list of forms. Now your surgery will have different forms to other surgeries. So check with your practice manager what they do have available. You can also download this app for yourself. You don't need to be registered in the practice to see what's there, but you can have a look then to see what your practice does supply. But routinely, it's sick notes, request a private letter, notification of change of address, stuff like this. When they choose to select something, it'll bring up a form for them then to fill out. And the patient submits this and sends it, and it comes through to your admin or your inquiries at email address for you to process that application then. If your surgery is using Ask My GP, eConsult or AccuRx, then this can also transport the patient to that platform as well. We will set it up with your practice, but the work will come in exactly the same way. There's no new training for you guys. It's just allowing the patients to submit these queries electronically and not having to phone you anymore. They can submit these out of hours as well. So, you know, if I'm phoning for a sick note, I don't really want to wait until 8 o'clock tomorrow morning to phone you guys to request a sick note and maybe sit in a queue for 6 or 7 minutes trying to get through. We can now encourage patients to use this functionality in the app. Okay, so if your surgery also does use Ask My GP, eConsult, or some kind of online triage platform, then the patient can also click on, I need help with a medical issue. So this button is for non-clinical, but this button is for clinical if they have a clinical query. They can click on this and it'll take them then to this example is for eConsult for tumble and cross hands, but obviously that will transport the patient then to your own surgery's eConsult, Ask My GP, or AccuRx triage platform, whichever company your surgery uses. If you don't use a surgery, then that button, you use an online triage platform, then that button will not appear in the app. Next is order repeat medication. So patients can click on here, and there's a message there to tell patients how long they need to wait. Again, we will work with your practice manager and build that message to your needs. Patients can now register for My Health Online through the app. They don't need to come into surgery anymore. They can click this button to register. Again, fill out this form, upload all the documentation. That is then submitted to you in practice. And you go through exactly the same process to register the patient as if a patient had filled it out in surgery. If they've already got an account, they can order repeat medication. Just click on that button there, and then it'll take them to the My Health Online portal for either IMPS Vision, or if your practice uses EMIS, we will again build that into the app with your practice manager, so it'll take the patient directly to the correct My Health Online portal. Next is NHS COVID Pass and NHS and the COVID Information Hub. So a lot of patients have been phoning you guys in practice to get help with booking vaccines or requesting COVID Pass. The information is now logged in the app for patients, so they don't have to phone you to get this information. The button says here, please do not contact your GP surgery about this. And then there's a button here, find out how to get your NHS COVID Pass. So when patients click on this, it transports them directly to the page they need to use to register for an NHS login for their COVID Pass. There's also a help section here, again, to try and reduce inappropriate phone calls into practices. Patients can click this button and then get help directly from NHS to get their COVID Pass. In the COVID Information Hub, if your practice wants us to set this up, we will do it for them. We can also link patients to first, second, and booster dose booking links, which your health board provides. Again, to try and reduce inappropriate phone calls for you guys, patients can now book through the app directly to get the first dose, second dose, and the booster vaccine. And there's also information there about testing for patients. So again, if your practice managers want us to make this available, we will make it available in the app for your patients. Next is book a blood test. So a lot of health boards now allow patients to book blood tests with their own phlebotomy department in hospitals. This is an example with Swansea Bay Health Board. Book a blood test. This opens up a link for patients. Here we are, Swansea Bay phlebotomy service. The patient can click the location they need to book. So let's say Singleton, and then select a date. Here we are, 17th, and then they can select the time they want to book in. So again, if your surgery does allow that feature, it will be enabled. And all of these buttons can be deleted or made active depending on what your practice manager's preference are. So do check with your manager what is available in the app. Book a routine appointment. So again, in the new contract now coming into force, GP contract coming into force in April, there is a requirement under access guidelines to be able to allow patients to book non-urgent appointments online in advance. So if that is the case and your surgery is going to go with that, then we put a button in the app to allow that. An example may be booking for a nurse appointment or a dressings or B12, blood pressure. These will not necessarily be on the day bookings with a GP, but this will only link patients to be able to book certain appointments. And again, we will work with your practice manager to build that functionality in. The next one then is help for my conditions. So you'll know many patients Google a lot of symptoms and they think they have something when in fact they don't. So we've built an entire directory of health resources for patients. They can scroll to find what they're looking for, or like Google, they can search and type in, for example, mental health. There we are. All the health resources are there now for them to look at. There we are, Mental Health Help in Wales. That resource will come up for them. Patients can self-refer, and there's an abundance of information in here, A to Z of health. They can click on this and they can get all the information they want then by scrolling, or again by using a search functionality. This is all built in, so patients don't need to Google anymore, and we only link to NHS information, nothing else in the app. Okay, below that button, again, is a link to a symptom checker. So we link to the NHS Wales 111 symptom checker. And again, this is available in English and in Welsh for patients. They can scroll to use the service and again, use the search functionality to find what they're looking for. Okay, the next button is community and voluntary services. So your practice is working in a cluster, which means that they work with neighbouring practices to you. And the whole point of that is to provide services closer to home. So much the same as this button here is a clinical lookup. This button here called Community and Voluntary Services is for non-clinical. So that could be for dementia carers group, counselling services, anything really that's available from the third sector, voluntary sector, and care navigators in your locality really. Your cluster will work with the third sector partners and send us information to populate the app here. So patients can find if they're looking for bereavement counselling or befriending groups, anything that they have to look for online, which is very difficult for some patients to find. We put all this information into one place for those patients. There may be other buttons that are active in the app, such as mental health hub, self-referral forms for physiotherapy, podiatry. Again, we will work with your practice manager and make these available in the app. So your app specific to your practice may look a little bit different to this with different content. But as I said, this is just an overview for you now to understand what is available in the app for patients. It's really putting everything in one place for patients so they don't have to use different services or go looking for different things. It's all in one place for them now, hopefully. Okay, so that's the home page in a nutshell. Next is Health Hub. Now, this is purely optional for patients. A lot of patients, as you know, take repeat medication, either short-term or long-term. So we've put a list of every medication prescribed by the practice in here. Patients can again look for medications that they're on using the search bar. But let's, for example, say I'm taking this as a repeat medication long term. I can favourite that medication as I'm taking it, and then I can set a reminder for myself. So I can say I want to take 1 tablet per day at 3 p.m. If I confirm that, the app will then automatically remind me as a patient in the calendar to take that medication at 3 o'clock every day. Because as you know, some patients do forget to take medications, but it also reminds them when the medication is running out. So we're all very used to patients coming in and say, oh, I've run out of my medication, and they run out on the same day and they want it straight away. Hopefully, by enabling this will remind the patient with a push notification to say, right, your meds are running out in 4 days' time. Why not click the button in the app's homepage and order your repeat medications? Hopefully then that'll avoid the scenario where patients come in and say, I've forgotten to order meds. So that's a feature patients can choose to use if they want to. The other one is My Conditions. So we do manage a lot of conditions in primary care, such as COPD, dementia, diabetes. Again, patients have annual review clinics or quarterly review clinics if they're poorly controlled. So again, patients can find information on, let's say, COPD. We link to all the NHS information in here. There's lots of educational videos for patients. This is a video on correct inhaler technique. But again, if the patient says, well, I do have COPD, so I'll favourite that. And they can set a reminder for themselves when their annual review clinic is due. So we can see here now I've set a reminder for myself for 7th of March, confirm that. Again, the app will remind the patient when their appointment is due with a push notification. So let's go to March. There we are, 7th of March, COPD annual review clinic is due. But also 14 days before that, it'll also send a notification to the patient automatically to say, contact your GP surgery to book an annual review clinic. Hopefully then you guys in practice as administrators will not have to keep chasing patients to come in for annual review clinics. They'll hopefully take charge of their own health, and once they get that notification, they'll phone you guys to say, look, my COPD clinic annual review is due. Can I book a nurse appointment, please? Or again, if your practice manager has allowed it, they can book a clinic online. And one of the options down here could be COPD clinic, and they can book online into Vision or EMIS then that way. There are other things in the Health Hub. Patients can upload care plans or upload images. These are not coded back and not sent to you. these are just for use by the patient. Again, patients asked us to build into the app the ability to add contacts. So if patients have a specialist asthma nurse in hospital, or they've got carers, or if they've got a midwife or a specialist diabetic nurse, they can upload that information. And again, instead of having to phone you to say, look, what's the number for the midwife, please? They can put it in there once and they've got a complete record then. So even during out of hours, they can call that midwife. So that's a really handy tool again for patients, again, to try and reduce phone calls coming into you guys in practice. Okay, so that's the Health Hub taken care of. The next tab along is your surgery. And this is what it says on the tin. This is basically information about your surgery. There's information about you, your address, how to call you, your opening times. And the app is updating next week on Monday, the 21st of February. And we will include front door opening times, telephone opening times, and if you have a dispensary in practice, it'll also include dispensary opening times. But again, we work with your practice manager to update that information. If you do have a branch surgery, then again, we can include that information in there, and the patient can find that information by toggling here. If you don't have a branch surgery, then that just simply will not appear in the app. Again, your practice manager may wish to show your practice team. It's also very good to do this because some patients do not know that, for example, nurse practitioners can prescribe medication, that pharmacists can now do medication reviews and titrate medication up and down. We can also put information there for midwives in there. So, you know, if the patient needs to call a midwife, we can put the number, and when the patient clicks on that button, the app will recognize it's a mobile number and automatically allow the patients to dial that number. We can also put information there for district nurses, health visitors, again, so they don't have to phone you guys in practice to constantly say, what's the number for the health visitor, what's the number for the district nurse. They can click on here and find the information and telephone that number without having to phone you guys constantly in practice. There's also a section for out of hours, so if patients need to phone the out of hours section, then that number is there for them. It tells them when it's appropriate to dial out of hours. There's information linked there to the NHS 111 website where it tells patients what they should be doing. We put that in English so you guys can see, and what is appropriate for 111 out of hours and what's not appropriate. Again, if you have a minor injuries unit, that information is there for patients and what they can access during that service. Again, there's a link to your cluster page, maybe a patient participation group, and there's links to your website, Twitter and Facebook feeds there, so patients can find that information really quickly. Okay, so this is all information that the patient needs on your surgery, and again, to try and reduce those phone calls coming into you guys. The last tab along here is what's on. So again, patients asked us to build this. This is really to tell patients what's going on in surgery and when. So let's, for example, take this year. Age UK online forum is available on February 22nd, 7 till 9. When the patient clicks on here, there would be more information on here to tell the patient how they can access that service. This may be useful for patients when you're building flu clinics or fluenza clinic for children, to tell patients when these flu clinics are on, or fluenza clinic, or when your BP clinics are on, or your diabetic clinics. And when patients click into this, they can then see how they can go about booking. Maybe they can book online, maybe they can call to book, maybe they submit a form to request something to you, or they can even fill a form to decline, to say, no, I do not want a flu vaccine, thank you. So that information is there for patients. So that's a real quick roundup of the app for you guys. Again, do check with your practice manager just to see what is available in your app. And again, just bear in mind as receptionists and administrators that we can build any kind of form and make it available in the app. So if you're getting a lot of phone calls coming through from patients to say, look, we want, I don't know, can I have a B12 injection, or can I have a joint injection? Well, instead of the patient phoning, we can build that form and put it into the app. So maybe have a think about what could save you time in having to receive all these phone calls. Let your practice manager know, and they can let us know, and we can build that form into the app. And then hopefully, again, that will reduce the amount of phone calls coming through to you guys in practice. So that's it. Thank you for watching this training session. Hopefully it wasn't too long. If you do have any questions, then please direct them to your practice manager, and they can direct those to us, and we can answer any questions you have. Okay, thank you.